Lung cancer. Smoking and lung cancer go together like peanut butter and jelly, except this sandwich can kill you. What makes lung cancer particularly terrifying is that it's not picky. Whether you're smoking a pack a day or occasionally lighting up just for stress, every puff is like buying a lottery ticket to Cancer Town. The culprit? Cigarettes are packed with carcinogens, over 70 of them actually. These nasty chemicals like formaldehyde, yes, the stuff they use to preserve dead frogs, benzene and arsenic, don't play around. When you inhale smoke, these toxins head straight for your lungs where they damage the cells that line them. Normally our bodies are pretty good at repairing damage, but with repeated smoking, it's like trying to repair a building that's constantly being bulldozed. Over time, the genetic damage accumulates and your lung cells can start growing out of control. That's how tumors develop, and before you know it, you've got lung cancer. It's a slow-motion train wreck where the driver, that's you, the smoker, keeps slamming the gas pedal. What's really wild is how lung cancer doesn't like to make a dramatic entrance. It's sneaky. By the time most people notice the symptoms, chronic coughing, shortness of breath, coughing up blood, the cancer's already thrown a house party in your lungs and invited itself to your liver, bones and brain. This is why lung cancer has one of the lowest survival rates. According to the American Cancer Society, only about 1 in 5 people diagnosed with lung cancer will survive beyond 5 years. Those aren't exactly odds you want to gamble with. But hey, don't take my word for it. The U.S. Centers for Disease Control and Prevention (CDC) points out that nearly 90% of lung cancer cases are caused by smoking. And if you think switching to light cigarettes will save you, think again. Studies show that light cigarettes are just as deadly because people tend to smoke more of them or inhale more deeply. So, whether you're puffing on a regular or a light cigarette, the cancer risk is still packing a punch. Chronic obstructive pulmonary disease, COPD. If you've never heard of chronic obstructive pulmonary disease, COPD, you're not alone. COPD sounds like one of those obscure medical terms you think won't apply to you until, surprise, you can't breathe. Essentially, COPD is what happens when your lungs say, "I'm done," and refuse to work as efficiently as they used to. Think of it like trying to breathe through a straw forever. Sounds fun, right? COPD is actually an umbrella term that covers 2 equally miserable conditions, emphysema and chronic bronchitis. Both are brought to you courtesy of smoking. Emphysema gradually destroys the air sacs in your lungs, making it hard to exchange oxygen. Chronic bronchitis inflames your bronchial tubes, causing a perpetual state of phlegm overload. Together, they create a respiratory nightmare. When you smoke, the chemicals in cigarettes don't just damage your lungs, they wage war on them. Over time, they destroy the elasticity of your airways and leave you gasping for breath after something as simple as climbing stairs. According to the World Health Organization (WHO), COPD is the 3rd leading cause of death globally, and smoking is the number 1 trigger. In fact, up to 75% of all COPD cases are caused by cigarette smoking. Erectile dysfunction. Now let's talk about something that might make you sit up straight. Erectile dysfunction, ED. That's right, smoking can affect your love life in ways you probably didn't expect. If you thought cigarettes just harmed your lungs and heart, think again. They're messing with the blood flow to every part of your body, including some of the most vital parts for intimacy. Smoking damages blood vessels, and erections are all about blood flow. When you're aroused, blood rushes to the penile arteries, making things, well, stand to attention. But smoking introduces harmful chemicals like nicotine that constrict blood vessels, reducing blood flow. It's like trying to pump water through a kinked garden hose, frustrating and ineffective. According to a study in European urology, men who smoke are twice as likely to experience ED compared to non-smokers, even at a young age. If the thought of damaged blood vessels doesn't make you toss out that pack of cigarettes, here's another kicker. Smoking affects testosterone levels. Yes, the hormone responsible for libido and sexual performance takes a hit too. A study from the Journal of Sexual Medicine found that smoking lowers testosterone, leading to decreased sex drive. So, in essence, smoking is sabotaging your romance on multiple fronts: less blood flow, lower testosterone, and more frustration. And here's the kicker. The damage to sexual health isn't always reversible. Quitting can improve things, but if smoking has done enough damage to your blood vessels, you might be stuck dealing with long-term consequences. So, it's not just your lungs that are gasping for air. Your love life might be too. Heart disease. Heart disease. If smoking doesn't knock you out with lung cancer or COPD, it's coming for your ticker. While most people associate heart disease with burgers and a sedentary lifestyle, smoking plays a leading role in making your heart an underperformer. Cigarettes are a cardiovascular nightmare. Every puff you take fills your bloodstream with toxic chemicals like carbon monoxide, which binds to your red blood cells, limiting their ability to carry oxygen. At the same time, nicotine gets your heart racing by narrowing your blood vessels and forcing your heart to work overtime. Basically, it's like asking your heart to run a marathon while wearing cement shoes. Over time, this added stress takes its toll. But wait, it gets worse. Smoking also leads to the buildup of plaque in your arteries, a condition called atherosclerosis. Plaque is like gunk clogging up your pipes, except these pipes are what deliver oxygen to your heart and brain. Block an artery to your heart and congratulations, you've won yourself a heart attack. Block an artery to your brain and you're looking at a stroke. It's no surprise, then, that the American Heart Association has declared smoking as a major cause of coronary heart disease, the deadliest form of heart disease. If you smoke, you're 2 to 4 times more likely to develop heart disease than a non-smoker. Want more bad news? Even second-hand smoke can raise your risk. That's right, just being around smokers can mess with your heart's plumbing. The good news, yes, there's a little, is that quitting smoking dramatically reduces your risk of heart disease. According to studies, within just 1 year of quitting, your heart disease risk drops to about half that of a smoker's. And after 15 years, it's almost as low as someone who's never smoked. So, while you might not be able to undo all the damage, quitting gives your heart a fighting chance. Stroke. Strokes are often treated like the bogeyman of medical emergencies, fast, terrifying, and with devastating consequences. But here's the thing. Smoking is basically rolling out the red carpet for a stroke to waltz into your life. And while you might think strokes only happen to older people, smokers are at risk much earlier. A stroke happens when the blood supply to your brain gets cut off, usually because of a blocked or burst blood vessel. No blood means no oxygen, and without oxygen, your brain cells start dying off at an alarming rate. The result? Permanent brain damage or even death. So how does smoking make you more likely to have a stroke? It all comes down to those sneaky little blood vessels. Smoking causes your arteries to stiffen and narrow over time, making it harder for blood to flow smoothly. It's like turning a highway into a bumpy dirt road. Plaque builds up in your arteries, increasing the likelihood of a blockage. If one of these blockages happens in the arteries leading to your brain, you've got a stroke on your hands. Not to mention, smoking increases blood pressure, which is the #1 risk factor for strokes. It's like adding extra pressure to a fragile dam. Eventually, it's going to burst. According to the CDC, smokers are twice as likely to have a stroke compared to non-smokers. And here's where it gets even scarier. Women who smoke and use birth control pills are at an even higher risk. Talk about a double whammy. The aftermath of a stroke can be devastating, leaving you with paralysis, difficulty speaking, or memory loss. It's not exactly the kind of break anyone wants. The silver lining, just like with heart disease, quitting smoking lowers your stroke risk significantly. In fact, within 5 years of quitting, your stroke risk is close to that of a non-smoker. So, if you value your brain cells, kicking the habit might just save your life. Peripheral artery disease, PAD. Peripheral artery disease, PAD, might not be as famous as heart disease or lung cancer. But don't let that fool you, it's just as deadly. PAD occurs when your arteries, particularly those in your legs, get clogged with plaque, reducing blood flow to your limbs. Smoking is the leading cause of PAD, and here's why. Nicotine narrows your blood vessels, while all those other chemicals in cigarettes damage the lining of your arteries. It's a 1-2 punch that leaves your legs gasping for blood. In the early stages, PAD might cause cramping or pain in your legs when you walk, but in more advanced cases it can lead to gangrene and amputation. Yes, you read that right. Smoking could cost you a leg, literally. According to the American Heart Association, smokers are at least twice as likely to develop PAD compared to non-smokers. And it's not just about discomfort or limited mobility. PAD raises your risk of heart attack and stroke. In fact, if you have PAD, there's a good chance you've got plaque building up in other arteries too, including the ones leading to your heart and brain. Quitting smoking is the single best thing you can do to prevent PAD from progressing. Within months of quitting, your circulation starts to improve and your risk of complications drops significantly. So, if you're fond of your legs and your heart and brain, quitting smoking should be a top priority. Oral cancer. When you think about smoking, you probably picture damaged lungs and stained teeth, but your mouth is on the front lines too. Oral cancer is one of the lesser talked about but equally deadly consequences of smoking. It affects everything from your lips to your tongue, cheeks, gums, and even the roof of your mouth. Basically, if it's in your mouth, smoking can give it cancer. Tobacco smoke is loaded with carcinogens, which are substances that can cause cancer. When you inhale, those carcinogens don't just stop in your lungs. They coat your mouth and throat, exposing your tissues to a constant onslaught of toxins. Over time, this repeated exposure can cause the cells in your mouth to mutate, leading to oral cancer. The American Cancer Society points out that 80% of people with oral cancer are smokers. If that statistic doesn't give you pause, consider that oral cancer can spread quickly to other parts of the body, including the lymph nodes, and has a high risk of recurrence even after treatment. Early symptoms of oral cancer might seem harmless at first. A sore that doesn't heal, a persistent lump, or even a sore throat. But once oral cancer sets in, it can lead to disfigurement, as parts of the mouth or jaw may need to be removed surgically to stop the cancer from spreading. In some cases, patients are left unable to speak, chew, or swallow normally. Quitting smoking reduces your risk of oral cancer, and the sooner you quit, the better your chances of avoiding this painful and potentially deadly disease. Emphysema. If your lungs had a worst enemy, it would be emphysema. Smoking doesn't just harm the lungs, it wrecks them. Emphysema destroys the air sacs in your lungs, turning what should be elastic, bouncy structures into stretched-out, floppy ones that can't efficiently exchange oxygen. This leads to a permanent shortness of breath that no amount of breathing exercises can fix. When you smoke, You're inhaling chemicals that cause inflammation in your lungs. Over time, this inflammation destroys the walls between the air sacs, reducing the surface area needed for oxygen exchange. It's like popping tiny bubbles in bubble wrap, except those bubbles are crucial to your ability to breathe. Once the damage is done, it's irreversible. Emphysema doesn't come and go, it sticks around for life. People with emphysema often end up relying on oxygen tanks just to get through the day. According to the National Heart, Lung and Blood Institute, about 80% of all cases of emphysema are caused by smoking. The disease can also lead to complications like collapsed lungs and heart problems. While quitting smoking won't reverse the damage already done, it will stop the disease from getting worse. So, unless you want to trade in your freedom for a portable oxygen tank, quitting is the best way to breathe easier. Chronic bronchitis. If emphysema is slowly suffocating your lungs, chronic bronchitis is like drowning in your own mucus. It's less glamorous than it sounds, too. Chronic bronchitis, a major player in the chronic obstructive pulmonary disease (COPD) gang, is caused by long-term inflammation of the bronchial tubes, the highways that carry air into your lungs. When you smoke, you irritate the lining of these tubes, and they respond by swelling and producing extra mucus to protect themselves. Except there's one problem. All that extra mucus doesn't just go away. Instead, the mucus builds up in your airways, turning every cough into a slimy, phlegmy nightmare, and those coughs don't stop. Chronic bronchitis doesn't get its name by accident. It's a never-ending condition, leaving you hacking and wheezing like an old car engine that just won't start. A cough here and there might seem harmless, but with chronic bronchitis, that cough is your body's desperate attempt to clear out its lungs that are permanently inflamed. According to the American Lung Association, smoking is the leading cause of chronic bronchitis. Around 90% of cases are linked directly to cigarette smoke. And it's not just a smoker's problem. Secondhand smoke can also cause chronic bronchitis in non-smokers, which means your bad habit could be giving someone else a lifetime of hacking fits. There's no cure for chronic bronchitis, but quitting smoking can stop it from getting worse. If you don't, the condition could eventually lead to severe respiratory failure. So, if you're tired of your morning cough being mistaken for the flu, maybe it's time to quit smoking before your lungs stage a full-on mucus mutiny. Pancreatic cancer. Pancreatic cancer is one of the deadliest forms of cancer, and smoking is a major risk factor. The pancreas is responsible for producing enzymes that help digest food and hormones like insulin that regulate blood sugar. When you smoke, carcinogens from cigarettes travel through your bloodstream to your pancreas, damaging cells and increasing the risk of mutations that lead to cancer. Pancreatic cancer is notoriously difficult to detect in its early stages, earning it the nickname the silent killer. The pancreas is located deep in the abdomen, so tumors can grow undetected for months or even years before causing noticeable symptoms. By the time signs like abdominal pain, jaundice, yellowing of the skin and eyes, or unexplained weight loss appear, the cancer is often in an advanced stage and has spread to other parts of the body. The American Cancer Society states that smokers are about twice as likely to develop pancreatic cancer as non-smokers. The connection is strong because smoking causes direct damage to the DNA in pancreatic cells. In addition, smoking increases inflammation in the pancreas, further increasing the risk of cancerous growths. Pancreatic cancer has one of the lowest survival rates of all cancers, with only about of patients surviving 5 years after diagnosis. The aggressive nature of this disease makes prevention key, and quitting smoking is one of the most effective ways to lower your risk. If you value your pancreas and your life, It's worth putting down the cigarettes before it's too late. Esophageal cancer. Esophageal cancer is another nasty side effect of smoking. The esophagus is the tube that connects your mouth to your stomach, and when you smoke, it's exposed to harmful carcinogens with every puff. Over time, these carcinogens damage the cells lining your esophagus, increasing the risk of mutations that lead to cancer. Esophageal cancer is particularly dangerous because it often goes undetected until it's too late. Early symptoms, such as difficulty swallowing or unexplained weight loss, are easy to ignore or misattribute to something else. By the time most people seek medical attention, the cancer has already progressed to an advanced stage, making it much harder to treat. According to the American Cancer Society, smokers are at a significantly higher risk of developing esophageal cancer than non-smokers. Even worse, smoking combined with excessive alcohol consumption raises the risk exponentially, creating a deadly combination for your esophagus. The prognosis for esophageal cancer is often poor, with only about 20% of people surviving 5 years after diagnosis. Quitting smoking is the most effective way to reduce your risk of this aggressive and often fatal cancer.